Hello, I'm Dr. Swati Baniga from the Eye Foundation Coimbatore, and today I would like to talk to you about an important topic, that is childhood squinting. So what is squinting? Squinting is simply the misalignment of the eyes, where when one eye is looking at the object of regard, the other eye is turned in another direction, which may be upwards, downwards, inwards, or outwards. So what happens when there is squinting? When both the eyes are not looking at the object of regard, there is a loss of depth of focus, what we call a deterioration of the 3D vision. Along with this, in younger children, there is a serious threat of loss of vision in the squinting eye, what we call the amblyopia or the lazy eye. So why does this develop? A young child's brain is not fully developed, and the visual areas are still developing and maturing in the early part of childhood. During this period, if one eye is constantly turned in another direction from the object of regard, the neuronal connections from that eye may not develop as strongly as they should have, resulting in a loss of the quality of vision. This is called as amblyopia or the lazy eye. 2 to 4% of all healthy children may develop squinting at any time from their birth up to their adulthood. Children who were born before the period of complete gestation, that is the preterm children, children who were born with a low birth weight, or who had a stormy neonatal period where they were seriously sick during the initial period of their life, have a higher tendency to developing squints. So how do we know that the child has a squint? Most often, the squinting is quite noticeable as a cosmetic issue where one eye is looking straight ahead and the other eye is turned in a different direction. Sometimes the angle or the magnitude of the squint may not be noticeably large enough, but the child may still complain of other symptoms such as tiredness, fatigue, inability to focus, or inability to concentrate, and sometimes older children may also complain of intermittent double vision. Squinting in itself may be constant or intermittent, and intermittent means that the squinting may sometimes be prevalent or obvious and sometimes not so obvious. The squinting tends to be more visible when the child is tired or is sick or is fatigued. This is known as the intermittent variation of squint. So what happens when you visit the doctor with a child who has a squint? We begin with checking the child's vision to see if the child has equal vision in both the eyes. Following this, the child undergoes a comprehensive eye examination where we look at each of the structures in the eye from the front, that is the cornea, up to the back of the eyes to look for anything that could cause a loss of quality of vision in either of the eyes. This could begin with corneal opacities, any lenticular opacities, what we call the cataracts, up to checking if the retina or the nerve layer inside the eye is healthy or not. That is because a change in the quality of any of the structures in the eye could also result in a blurry vision, which could then cause the squint. Once we finish the comprehensive eye examination, we then look to see and measure the magnitude and the direction of the squint. Along with this, during the visual checkup, we also make it a point to look for the 3D vision of the child and see if it has developed normally or not. Thank you.